Assalamu alaikum. I'm Dr. Ayesha. Today we are going to talk about arteries on the dorsum of foot. Main artery supplying the dorsum of foot is Dorsalis Pedis artery, which is also known as dorsal artery of the foot. This is basically a continuation of anterior tibial artery onto dorsum of foot. Let's talk about origin and course of Dorsalis Pedis artery in detail. This is an image showing origin of Dorsalis Pedis artery. As I have already told you, Dorsalis Pedis artery is the continuation of anterior tibial artery, which you already know is the branch of popliteal artery. Let's have a review of anterior tibial artery. In the popliteal fossa, popliteal artery divides into two branches, which are anterior tibial artery and posterior tibial artery. Anterior tibial artery then enters the anterior compartment of leg by passing through an opening in the upper part of interosseous membrane. At this point, it then runs vertically downwards into the anterior compartment up to the point midway between the two malleoli. This is medial malleolus, this is lateral malleolus. At this point, at the midpoint of these two malleoli, this anterior tibial artery, it changes its name and become the Dorsalis Pedis artery, which is the main artery on the dorsum of the foot. So let's begin with the course of Dorsalis Pedis artery. This is an image showing course of Dorsalis Pedis artery on the dorsum of foot. Before starting its course, I would like to give you a brief review of the skeleton of the foot. I know you already know the bony skeleton of foot now, but I would like to give you a brief review so that you can easily understand the branches and relations of this artery on the dorsum of foot. This is tibia, this is medial malleolus of tibia, this is fibula, and this is lateral malleolus. This large bone, which you know articulates with the lower end of the tibia, is talus. This is calcaneum. This bone is navicular bone. This is cuboid, and these three small bones, which you can see here, are the cuneiform bones. This is medial cuneiform, intermediate cuneiform, and lateral cuneiform. These are the metatarsal bones. This is intermetatarsal space, which you know is the space between two metatarsal bones. These are the phalanges. We have two phalanges in the big toe and three phalanges in the rest of four toes. Now let's begin the course of Dorsalis Pedis artery. This is anterior tibial artery. This anterior tibial artery, it becomes the Dorsalis Pedis artery just in front of the ankle at a midpoint between these two malleoli. So Dorsalis Pedis artery, it begins in front of the ankle between these two malleoli. This is Dorsalis Pedis artery. It then runs anteromedially like this, deep to inferior extensor retinaculum between the tendons of extensor hallucis longus and extensor digitorum longus muscle on the dorsum of foot. This artery, it takes an oblique path on the dorsum of foot. It courses over the dorsal surface of talus, navicular bone, and the intermediate cuneiform bones, and reaches the first intermetatarsal space right here. At the proximal end of first intermetatarsal space, this Dorsalis Pedis artery, it gives off a branch which is known as first dorsal metatarsal artery. We'll talk about this artery in a while. After giving off this branch, this Dorsalis Pedis artery, it then runs downwards, or it dips down between the two heads of first dorsal interosseous muscle which arises from the first two metatarsal bones, adjacent sides of these two metatarsal bones. After passing between the two heads of first dorsal interosseous muscle, this dorsalis pedis artery, it enters the sole of the foot as a deep plantar artery. This rounded part, which you can see here, is indicating the deep plantar artery, which is the main continuation of dorsalis pedis artery. On the sole of the foot, this deep plantar artery, it joins the lateral plantar artery, which we'll talk about in our next lecture, to form the deep plantar arch on the sole of the foot. So far we have learned that anterior tibial artery, it ends at a midpoint between these two malleoli, and it becomes the dorsalis pedis artery, which then courses over the dorsal surfaces of talus, navicular bone and the intermediate uniform bone to enter the proximal end of first intermetatarsal space. This is the first intermetatarsal space. At this point, dorsalis pedis artery, it gives off a branch which is known as first dorsal metatarsal artery, which supplies the big toe, and it runs downwards into the sole of the foot as deep plantar artery. This deep plantar artery, it joins the lateral plantar artery and forms the deep plantar arch on the sole of the foot. Now we'll talk about branches of the dorsalis pedis artery. Dorsalis pedis artery gives off 4 branches on the dorsum of foot. The first branch which arises from this artery is the lateral tarsal artery. Second branch is the medial tarsal artery. Third branch given off by the dorsalis pedis artery is the arcuate artery. The fourth branch is the first dorsal metatarsal artery. We'll talk about these arteries in detail individually. Now the first branch of dorsalis pedis artery is the lateral tarsal artery. This artery arises from dorsalis pedis artery as it crosses the navicular bone at this point. From its origin, the artery travels laterally like this and passes deep to the extensor digitorum brevis muscle. Lateral tarsal artery supplies extensor digitorum brevis muscle. In addition to this, it also supplies adjacent tarsal bones and tarsal joints. As you can see here, these are the branches given to the tarsal bones and tarsal joints. In addition to this, lateral tarsal artery also forms an anastomosis around the ankle joint. It anastomoses with the anterior lateral malleolar artery, which is a branch of anterior tibial artery, and takes part in anastomosis around ankle. It also anastomoses with the arcuate artery, which is the third branch of dorsalis pedis artery. Now the second branch is medial tarsal artery. Medial tarsal arteries, these are basically 2 to 3 in number. As you can see here, they arise from dorsalis pedis artery and courses medially like this, deep to the tendon of extensor hallucis longus muscle. These arteries, they supply structures on the medial aspect of the ankle and the midfoot, including the adjacent tarsal bones and tarsal joints. Medial tarsal arteries, they also take part in anastomosis around the ankle joint. As we talked about in lateral tarsal artery, these medial tarsal arteries also anastomose with the anterior medial malleolar artery, which is the branch of anterior tibial artery, and takes part in anastomosis around the ankle joint. Now the third branch on the dorsum of foot is the arcuate artery. This transverse artery which you can see here is the Arcuate Artery, which is the third branch of Dorsalis Pedis artery. This artery arises close to the medial cuneiform bone at this point, just close to the medial cuneiform bone. It travels laterally like this, deep to the digital extensor tendons. This artery courses over the bases of second, third, fourth and fifth metatarsal bones. These are bases of metatarsal bones and these are heads of metatarsal bones. This artery courses over the bases of lateral 4 metatarsal bones. At this point, Arcuate Artery, it anastomoses with the lateral tarsal artery like this and forms an arterial loop on the dorsum of the foot. This is the arterial loop which is formed by the anastomosis of lateral tarsal artery and the Arcuate Artery. This one. Now the last branch of Dorsalis Pedis artery is the first dorsal metatarsal artery. As I have already told you that this Dorsalis Pedis artery, when it reaches the proximal part of the first intermetatarsal space, it gives off its last branch, which is first dorsal metatarsal artery, this one, and then it dips downwards into the sole of the foot as a deep plantar artery. This first dorsal metatarsal artery, it travels along the superficial surface of first dorsal interosseous muscle. Along its distal course, this artery, it gives off a dorsal digital branch, this one, which supplies the medial side of the great toe, this one. Then this artery, it runs downwards and further divides into two dorsal digital branches. These two branches which you can see here, these are the dorsal digital branches of first dorsal metatarsal artery, which supply the adjacent sides of first two toes, which are the lateral side of great toe and the medial side of second toe. So first dorsal metatarsal artery, it supplies the medial side of the great toe and lateral side of the great toe and medial side of the second toe. Now what about the other toes? The lateral 4 toes, these are supplied by branches from the Arcuate Artery. Let's talk about these branches. Now let's talk about the arterial supply of the lateral 4 toes. This is Arcuate Artery. This Arcuate Artery, it gives rise to 3 dorsal metatarsal arteries, 1, 2 and 3. These 3 dorsal metatarsal arteries, they arise from the Arcuate Artery and supply the adjacent sides of second, third, fourth and fifth metatarsal bones and the muscles arising from these bones. This is second dorsal metatarsal artery, this is third dorsal metatarsal artery and this is fourth dorsal metatarsal artery. Further distally, as you can see here, each dorsal metatarsal artery further divides into 2 branches, which are the proper digital arteries. These proper digital arteries, they supply the adjacent sides of second, third, fourth and fifth toes. These proper digital arteries, they are supplying the adjacent sides of second, third, fourth and fifth toes. Another important point which I need to mention here is these arteries, they end proximal to the distal interphalangeal joints of these toes. These are distal interphalangeal joints of these toes. These proper dorsal digital arteries, they end just proximal to this distal interphalangeal joint This last distal phalanx of the toes and the nail beds, they are supplied by plantar digital arteries. We will talk about these plantar digital arteries in our next lecture. For now, just remember these dorsal metatarsal arteries, they divide into two dorsal digital arteries which supply the adjacent sides of second, third and fourth, fifth toes. They supply the proximal and middle phalanges of these toes. They end just proximal to the distal interphalangeal joint. They don't supply the distal phalanges of these toes and nail beds. Now coming to the blood supply on the lateral side of the fifth toe. The lateral side of the fifth toe is supplied by dorsal metatarsal artery for the fifth toe, which arises from this arterial loop formed by lateral tarsal artery and the arcuate artery. This arterial loop gives off a branch which is supplying the lateral side of the fifth metatarsal and the fifth toe. Let me show you another image in which these branches are much more clear. This is an image showing arterial supply on the dorsum of the foot. This is the Dorsalis Pedis artery. This is lateral tarsal artery, which is the first branch of Dorsalis Pedis artery. These smaller arteries which you can see here are the medial tarsal arteries. This transverse arch or branch which you can see here is the Arcuate Artery, which is forming an arterial loop with the lateral tarsal artery. This is the deep plantar artery, which is the continuation of Dorsalis Pedis artery into the sole of the foot. This is the first dorsal metatarsal artery, which is the last branch of the Dorsalis Pedis artery, which is supplying the medial side of the great toe and the adjacent sides of first and second toes. As you can see here, these dorsal digital arteries, they end just proximal to the distal interphalangeal joint at this point. This distal phalanx and the nail beds are supplied by the plantar digital arteries. These green colored branches are the dorsal metatarsal arteries which arise from the arcuate artery. They are supplying the adjacent sides of the second, third, fourth and fifth metatarsals and the toes. These are the dorsal digital branches of these dorsal metatarsal arteries. That's all about the arteries on the dorsum of the foot. This is a flow sheet showing arterial supply on the dorsum of the foot. I have summarized today's lecture in this flow sheet. Let's have a quick review of this. First of all, we have anterior tibial artery. Continuation of anterior tibial artery onto the dorsum of foot is Dorsalis Pedis artery. This Dorsalis Pedis artery, it gives off 4 branches on the dorsum of the foot. The first one is lateral tarsal artery, which supplies lateral part of the dorsum of foot, midfoot and ankle. Then comes the medial tarsal artery. It supplies the medial side on the dorsum of the foot. Both these branches, they take part in malleolar network, or you can say in anastomosis around the ankle joint. Then comes the arcuate artery, third branch of the Dorsalis Pedis artery. This arcuate artery, it further gives off 3 branches, which are second, third, fourth dorsal metatarsal arteries, which run in the second, third and fourth intermetatarsal spaces, supply these spaces and muscles, and then divides into dorsal digital arteries. These dorsal digital arteries, they supply dorsum of the adjacent sides of second, third, fourth and fifth toes. One thing which I missed in my lecture is these dorsal metatarsal arteries, they also communicate with the plantar metatarsal arteries on the sole of the foot. through different perforating veins, perforating arteries. We'll talk about these perforating arteries in our next lecture when we'll do the arteries on the sole of the foot. For now, just remember these dorsal metatarsal arteries, they also communicate with the plantar metatarsal arteries on the sole of the foot through perforating arteries. Then comes the fourth and the last branch of Dorsalis Pedis artery, which is the first dorsal metatarsal artery, which is supplying the adjacent sides of the first and second toe, which is the lateral side of the toe, big toe, and medial side of the second toe. It also gives off a branch to the medial side of the great toe. That's all about arterial supply on the dorsum of the foot. Now let's discuss the Dorsalis Pedis pulse. 3 important points which you need to know about the Dorsalis Pedis artery and its pulse are the site at which we can palpate the Dorsalis Pedis artery. The second one is the significance of Dorsalis Pedis pulse. Why do we need to palpate the Dorsalis Pedis artery? And the third one is variation in the Dorsalis Pedis artery and its pulse. Now let's discuss this site at which the Dorsalis Pedis pulse can be taken and the method of palpation of Dorsalis Pedis artery. We palpate the Dorsalis Pedis artery between the tendons of extensor hallucis longus muscle and the tendon of extensor digitorum longus muscle to the second toe. This palpation is performed at the level of bases of first and second metatarsal bones at this site. This is the point where the pulse is taken. We ask the person to slightly dorsiflex his foot so that tension on the dorsum of the foot is reduced and pulse can easily be taken against the underlying tarsal bones. Now let's discuss that why do we need to palpate the Dorsalis Pedis artery, or what is the significance of taking Dorsalis Pedis pulse? This pulse is used to evaluate the peripheral vascular system. Peripheral vascular system, it includes both upper and lower limbs. In certain cases, as in peripheral arterial disease, lower extremities, they don't get sufficient blood. Peripheral arterial disease may include pulmonary embolism, varicose veins, or renal insufficiency. In these cases, lower limbs don't get sufficient blood. There is absent pulse in the Dorsalis Pedis artery. There is another important fact which you need to know is, in some healthy adults, they may have congenitally non-palpable Dorsalis Pedis pulse, but this variation is bilateral. Absent Dorsalis Pedis pulse doesn't always indicate that there is some abnormality or there is any peripheral arterial disease. If this absent pulse is bilateral, this shows that there is some congenital abnormality in the Dorsalis Pedis artery. But if absent pulse is found in one side only, it always indicates the peripheral arterial disease and insufficiency of blood supply into the lower extremities. The last thing which I need to mention here is, there may be variation in the Dorsalis Pedis artery and its location. In cases of congenitally absent Dorsalis Pedis artery, this artery may be replaced by an extended perforating fibular artery of smaller caliber than typical Dorsalis Pedis artery. This perforating fibular artery, it runs in the same location as the Dorsalis Pedis artery. That's all about today's lecture.